Welcome to KJTV for your greatest news and programs. I'm glad you're here to listen to wonderful program coming to you. And please don't forget to subscribe or give us thumbs up. Welcome to KJTV. And in the studio we have Dr. JUDI Wanyama, who is a doctor in nursing practice, also a psychiatric mental health nurse practitioner and a certified nurse practitioner. Welcome, JUDI.
Thank you so much, Dr. Wani.
Yeah, it was good for you to come to the studio and to talk about this very vexing point about the connection between mental health and drug abuse. But before we even that, can you tell us about yourself and how you became a nurse practitioner on mental health?
Thank you so much. So, like you said, my name is JUDI Wanyama. I have been in practice for over 4 years now. I take care of people, and I realize there's a connection between the physical health and the mental health. So, the reason I decided to go back to actually focus on mental health is because I realized I cannot treat the physical body without focusing on the mental health too. Because I can treat an ailment, but if it's physical symptoms like high blood pressure, I also needed to look at what else is going on with the mind. Is this person stressed? Do they have anxiety? What's going on at home? So that's the reason I decided to, pursue mental health.
Okay. Yeah. Well, that's good. And why are you so passionate about this program?
So I am passionate about it because I think we don't focus enough on mental health. Mm-hmm. And I have seen a lot of people being castigated from the community or just feel out of place because nobody wants to associate with them or talk to them because they have a mental health disease or issue.
Okay.
Yes.
Now, how has mental health affected the people? As you said, what connection do we have between mental health and the drug addiction?
So the connection between mental health and drug addiction is, one leads to another. Mm-hmm. So what I've seen is sometimes if somebody is so lonely and they cannot maybe associate with other people or family has shunned them away, then what happens is they decide, okay, maybe alcohol would be a good solution. And with alcohol, it gives somebody some euphoria, some confidence. Okay. And that's why alcohol and any other drugs are really, a way for people to escape from their mental health illness.
Oh, sure. Mm-hmm. Now, between these, the connection now, what are some of the examples you can say of some mental ailment which you find in your practice?
Yeah. So I diagnose a lot of mental health illnesses. Mm-hmm. So I'll talk about depression, for example.
Yeah.
So we live in Minnesota, which is very cold, and they've often associated mental health with not being able to get out, not being able to get exercise, because we know exercise gives us good endorphins. Yeah. So if we don't get that exercise and interaction, what happens is, sometimes you end up sleeping too much, not wanting to interact with people, feeling really tired, or, just having a disconnect, not wanting to eat, and you end up not taking care of yourself. So those are some of the signs of somebody who's suffering from depression. So the cold, loneliness, lack of family connections, those are all contributors to depression.
Now, I think it was a few days ago we had an incident where a young man was shot dead in Brooklyn Park, in the outside the African store.
Yes.
And as people were demonstrating, I hear there was other gunshots.
Yes.
People. What can you say? What was the contribution of the drugs on the incident?
The incident. So what has happened in the last year, for example, is a lot of young men and women did not really have any interaction in the schools. So what they decided to do is, there's been gangs, and they've been talking about the gangs in around the Brooklyn Park area. Okay. So I have followed up that story very passionately. This young man was 17 years old, and he was not involved in the shooting, but he was shot like 7 times in the back of a car. So what they said, or what the parents have attributed that to, is the fact that he was interacting with wrong friends, or peer pressure contributed to this, because they understand that they're friends that he was trying to connect with, and maybe if they had known, or they could have really just reached out and tried to help him out instead of having him interact with his friends. So what drugs involved, definitely. And that is a really high crime spot area, because there are drugs there, and these kids are taking these drugs like it's a candy. Yeah.
Now there was also an incident where we had a lady, a Kenyan lady, I don't know, in another state, who died.
Yes.
She was drunk. And she was driving, I think, on the wrong way or something like that.
Yes.
And the her death was much attributed to drugs.
Yes.
This is a situation I want you to talk about more especially. We are having young people who are immigrants. What are some of the challenges and which is getting them into this position, and what should the community do?
Okay. So what I was saying is sometimes when we don't have that community connection, when we are not able to get somebody to tell us, you know what, you're going down the wrong path. When we don't have that, when we don't have somebody rallying around us, and even when we see somebody has a mental health problem, when we shun these people away, they will turn to drugs, because that's a solace for them. So what has happened, like the lady you're telling me, maybe she found solace in alcohol, and alcohol will give you some kind of bravado.
Yeah.
And then you go out there, you're driving, of course you don't even realize you're driving on the wrong way. So what we lack is connection. We don't have support. We have a society that will shun you away.
Condemn you.
They will condemn you. That's the right word. Yes. Yeah. So that's what we lack. And I hope in the future, if we talk more about mental health and drug addiction, we're able to save more young lives.
Yeah, as we say in the community, how can we bring them from looking at these people as condemned people? Like somebody, when you hear someone's child is using drugs, it's like you pass judgment on the person. And that actually makes this person get alienated from the community. What should we do, first from within the family and the community, to help this?
To help this. So mental health, first of all, should be considered as a disease just like hypertension, just like diabetes. And one thing I always tell people is sometimes people have genes that will draw them towards maybe using.
Okay.
Like alcohol, for example. And so what we need to do is rally around that person, because here, tomorrow it is, today it's me, tomorrow it could be somebody else. Yeah. We all have children here. So the first thing we need to do is look at mental health as it's not a curse. Okay. It's a disease just like cancer, just like diabetes. That's where we need to start.
Yeah, but you see also why most especially the immigrant community get this problem. We come from a culture where a child belongs to a community. Yes. And then we come to the American culture, which is more individualistic. Yes. I mean, it's like, I cannot poke on other families' business because it's individualistic. That's a family problem. And that's what is causing problem. So how can we blend the two cultures so that we can combat this problem of mental health?
So just how we look at death, for example,
Yeah.
when somebody dies, we rally around the family, we contribute so much money when these people have died so that we can send the bodies back home, so that we can give them the best coffins. But one thing we need to understand is it all started somewhere. And so if we can look at how we come together as a community to support somebody who has passed away, maybe we need to have the same compassion for families who have children who are struggling. And it's not even about mental health. It could be, somebody who has a child who has, who is autistic, who has special needs.
Yeah.
What are we doing about that?
About it.
Yeah.
Yeah, I mean, that is a good point you have brought, that the way we deal with bereavement, which is very good to help people recover. But then, when it comes to like when you realize your child is taking drugs,
Yes.
it's like your secret. You want to hold it a secret because the community will condemn you. What will you tell the community people to do so that somebody can come out clear and talk about the challenges? Because they fear stigmatization in the community. How can we deal with that?
How can we deal with that? We've come a long way, and I'm going to give you an example. HIV, for example, we stigmatized people who had HIV until we have seen that, it's really just another disease. So with mental health, and I think parents take it so hard on themselves because they feel like society will condemn them. Society is going to look at them as, you're not a good parent, or you did something wrong somewhere.
Yeah.
That's why this child is this way. But one thing we have to do is encourage a few parents to come out. Even, encourage them to talk about these things openly. We need to have forums where parents can talk about what's going on with their children. Because if we don't do that, what's going to happen is then we end up with kids who are being killed in the streets because they're seeking solace with friends outside the culture, outside our community. So that's where we start.
I mean, and I like the way you put. One of the young man was talking to me and said, when I go home, it's like my parents don't want to talk to me. They have written me out. And now I just want to, I'm comfortable with my friends taking drugs. What should parents do first to kids when they learn that? Everybody's a shock. What advice can you give the parents to deal with this issue of mental health or drug addiction when they know it from their children first?
So I would encourage all parents to actually embrace these kids. Because the minute you embrace them, the minute you tell them, you're not lesser because you're taking alcohol. You're not less of a human being because you're taking drugs. You want to embrace them because then when they're in trouble, they will call you.
Okay.
Yes. Because then they know that, my friends are not more important than my family. Yes.
Yeah, they need to show empathy.
Yes.
Not the time to condemn.
Not the time to condemn.
Good. That's very good.
Yeah.
Now, tell me more about what drugs you are seeing as you are practicing. What are some of the drugs many people are using in the community?
So I have come across marijuana. I know marijuana is it's legal in some states, and medical marijuana is legal, but we still consider it as a drug. I have seen amphetamines. So meth, they call it meth. Sometimes you hear, they call it salts. That's our stimulant. That's a nickname. There's another one called Mbox. So Mbox are pills. These are fentanyl pills. And so these come in 30s. Apparently, those are very deadly. And most of this, patients who are taking them could be as young as 13. Oh. So that's the new word, Mbox.
Mbox.
Mbox for fentanyl. Yeah. And then we have cocaine. We have drugs are available to these kids. Yeah, all they have to do apparently is, call a number
and get the
medications. I mean, they can't know where the supplies are.
okay.
Yes.
So I mean, they call it. Is it illegal to sell those drugs?
No, all these drugs are illegal. But what is happening is, the kids have connections. They know, and they'll tell you, oh, you know what? I know a friend who knows a friend who's gonna sell me this drugs. And see, that's what I didn't know. So Facebook, there's Twitter, there's all this places.
Well, yeah. You have reminded me something very important. Here was a family was trying to protect their children from bad company. So they have these strict rules. They go, their kids, if they go to church, from church, they don't want to interact, they go home. They have monitored their kids. But they came to realize that the kids have those drugs. When they come home, they are on the internet, they are connecting, they do that, and then they got the drugs. They were shocked, like they were protecting their kids, but they are still getting. So what will you talk about this internet, which is actually, even if you try to protect these people physically, electronically they are connected everywhere.
Electronically, they are connected everywhere. And you know what? You would be surprised how many predators are out there. You'd be surprised the connections these kids have. Because, I didn't know, about the Instagrams. I didn't know about, the Facebooks. And here, they don't have to have a physical number to call. All they have to do is go to a website or have an account. And they know about accounts. And these kids are so internet savvy. Yes, too smart.
I found my granddaughter who's 7 years. She can go to my phone and download a program, an app, and sometimes but it's a challenge. And we are having many parents who are not tech savvy.
Yes.
So, what are some of the approaches we can employ to curb this pandemic? Now that we have an enemy within, what advice would you give? Which approach can we fight this?
One, I'd say it's not taking away the gadgets, but encourage your kids to bring their friends home so that you know who they're interacting with.
Okay.
Encourage them to tell you, what's going on. And sometimes they are more than happy to share with you what's going on at school. They are more than happy to tell you, oh my gosh, you know what? This is a new program. This is what so-and-so is doing. So that you are able to correct them at that early stage before things get out of hand.
Instead of chasing the friends away, bring them closer.
Bring them closer so you know who they're hanging out with.
That's a very good thing. I will think we have had a good conversation with you. We will go for a break and then come back to continue with this. So stay tuned with us, and we will get you to the second part of the program. Stay with us.